Welcome to NSG 311 Study Session 2, Primary Health Care, PHC. Introduction. Primary health care is the first level of contact with the national health delivery system for individuals, families, and communities, bringing quality health care as close as possible to where people live and work. In this study, you will learn about the concept of primary health care, core principles of primary health care, and nurses' involvement in primary health care. Learning outcomes for study session 2. At the end of this study session, you should be able to 1. Explain concepts of primary health care. 2. Identify the core principles of primary health care. 3. Describe nurses' involvement in primary health care. The concept of primary health care, PHC. In 1978, the World Health Organization and member states in the Declaration of Alma Ata highlighted the gross inequality in the health status of the people, particularly between the developed and developing countries, as well as within countries. It was noticed that there was an ever-widening inequalities in the burden of disease and in access to care, both between and within countries, whether industrialized or developing. To address all this, WHO focused on PHC as the key to attaining the goals of its 1977 strategy, Health for All, by the year 2000. This was reconfirmed at Riga in 1992, but timeline reviewed to 2015, Millennium Development Goals. When PHC was embraced in 1978, it was seen as the optimal route for improving health and addressing the enormous challenges facing healthcare systems. It is thus necessary to take stock and learn from the various successes and failures. Defining public health care. Public health care is the essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally acceptable to individuals and families in the communities through their full participation and at a cost that the community and country can afford. Public health care, a basic level of health care that includes programs directed at the promotion of health, early diagnosis of disease or disability, and prevention of disease. Primary health care is provided in an ambulatory facility to limited numbers of people, often those living in a particular geographical area. It includes continuing health care as provided by a family nurse practitioner. Mosby's Medical Dictionary, 2009. Public health care socially appropriate, universally accessible, scientifically sound, first-level care provided by a suitable trained workforce supported by integrated referral systems and in a way that gives priority to those most need, maximizes community and individual self-reliance and participation, and involves collaboration with other sectors. It includes the following: 1. Health promotion. 2. Illness prevention. 3. Care of the sick. 4. Advocacy. 5. Community development. Australian Primary Healthcare Research Institute. In other words, PHC is an approach to health beyond the traditional healthcare system that focuses on health equity, producing social policy. PHC includes all areas that play a role in health, such as access to health services, environment, and lifestyle. Thus, primary health care and public health measures taken together may be considered as the cornerstones of universal health systems. At the broadest level, PHC includes all services that play part in health, such as income, housing, education, and environment. It includes primary care, that is, the diagnosis and treatment of illness and injuries. It also includes critical elements of health promotion and prevention of illness and injuries. One of the greatest strengths is citizen participation in needs identification and service delivery, and bringing these services as close to people as possible. Challenges facing global health. Public health care, together with economic and technological advances and targeted disease funding, contributed extensively to these gains. However, since then, the HIV/AIDS pandemic has tragically affected this increase in life expectancy in sub-Saharan Africa. However, there are many more challenges facing global health. 1. The rising cost of health care. 2. Increasing consumer expectations and demands. 3. Changing demographics and aging populations. 4. Nursing and other healthcare workers shortages. 5. Legislation and/or political will to fully utilize nursing potentials. 6. Social conflict and unrest which destabilize services and constrain resources. 7. Natural and man-made disasters. 8. Endemic and pandemic diseases, as well as new and reimagined ones. 9. The surge of chronic diseases. 10. Making shifts to community-based care. Some health outcomes have improved significantly. Many diseases, such as measles and poliomyelitis, have been better controlled. Others, like smallpox, have been eradicated. Immunization rates have improved in most countries across the world, especially in developing countries, by up to 80%. There is now a significant decline in infant and child mortality and a substantial increase in life expectancy. International evidences suggest that healthcare systems based on strong PHC orientation have better and more equitable health outcomes, are more efficient, have lower health care costs, and can achieve higher user satisfaction than those whose health systems have a weak PHC orientation. Core principles of public health care. The Declaration of Alma Ata suggests that PHC work focus on 5 core principles. 1. Active public participation. 2. Accessibility. 3. Health promotion and chronic disease prevention and management. 4. The use of appropriate technology and innovation, including knowledge, skills, and information. And 5. Intersectoral cooperation and collaboration. These principles will create a strong framework for building primary healthcare system through networked research. These are some other core principles of public healthcare. 1. Equal and universally accessible health services. No geographical or financial geographical barriers. 2. Community participation in defining and implementing health agenda. 3. Intersectoral approaches to health. 4. Appropriate technology. 5. Emphasis on prevention and health promotion. Elements, components of public health care. Primarily, there were 8 components of public health care. 1. Health education. 2. Promotion of food supply and proper nutrition. 3. Provision of adequate supply of a safe water and basic sanitation. 4. MCH including FP. 5. Immunization, both maternal and child. 6. Treatment of minor ailments and injuries. 7. Prevention and control of local endemic and epidemic diseases. 8. Provision of essential drugs. Secondary elements added with time were 1. Dental or oral health. 2. Mental health. The recently included ones are 1. Care of the disabled. 2. Care of the elderly. 3. Occupational health. 4. Prevention and management of non-communicable diseases. The ultimate goal of primary health care is the attainment of better health services for all. The World Health Organization, WHO, has identified 5 key elements to achieving this goal. 1. Reducing exclusion and social disparities in health. Universal coverage reforms. 2. Organizing health services around people's needs and expectations. Service delivery reforms. 3. Integrating health into all sectors. Public policy reforms. 4. Pursuing collaborative models of policy dialogue, leadership reforms. And 5. Increasing stakeholder participation. Behind these elements lies a series of basic principles identified in the Alma Ata Declaration that should be formulated in national policies in order to launch and sustain PHC as part of a comprehensive health system and in coordination with other sectors. 1. Equitable distribution of health care. According to this principle, primary care and other services to meet the main health problems in a community must be provided equally to all individuals irrespective of their gender, age, caste, color, urban or rural location, and social class. 2. Community participation. In order to make the fullest use of local, national, and other available resources, community participation was considered sustainable due to its grassroots nature and emphasis on self-sufficiency as opposed to targeted or vertical approaches dependent on international development assistance. 3. Health workforce development. Comprehensive health care relies on adequate number and distribution of trained physicians, nurses, allied health professions, community health workers, and other working as a health team and supported at the local and referral levels. 4. Use of appropriate technology. Medical technology should be provided that is accessible, affordable, feasible, and culturally acceptable to the community. Examples of appropriate technology include refrigerators for vaccine cold storage. 5. Multi-sectional approach. Recognition that health cannot be improved by intervention within just the formal health sector. Other sectors are equally important in promoting the health and self-reliance of communities. These sectors include at least agriculture, e.g., food security, education, communication, e.g., concerning prevailing health problems and the methods of preventing and controlling them. In sum, PHC recognizes that health care is not a short-lived intervention, but an ongoing process of improving people's lives and alleviating the underlying socio-economic conditions that contribute to poor health. The principles link health and development, advocating political interventions rather than passive acceptance of economic conditions. Nurses' involvement in primary health care. Nursing practice is the very essence of primary health care. This is because our education, experience, and the settings where we work make it so. Nurses deliver services wherever people have found, in homes, schools, workplaces, prisons, health and wellness clinics, and other community settings, as well as hospitals and research centers. In virtually every country of the world, nurses constitute the healthcare provider group. They are also critical to the training and supervision of other health personnel and to the planning, organization, monitoring, and evaluation of PHC services. Primary healthcare nurses adopt the definition of health in the Declaration of Alma Ata that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Impact of nursing on primary health care. Primary health care can be discussed from nursing perspectives. Having nurses at the center of PHC means 1. Improved access to care. 2. Improved prevention of chronic diseases. 3. Improved cost effectiveness. 4. Improved health outcomes. 5. Improved surveillance. 6. Improved disaster management and recovery. 7. Improved patients' compliance with care. 8. Leveraging technology for PHC. 9. Improved data gathering and generation. 10. Improved maternal and child health through counseling, etc. 2.3.2 The roles of a primary health care nurse. A model of the roles of nurses is that their work may cover 1. Health promotion, 2. Illness prevention, 3. Midwifery, antenatal and postnatal care, 4. Treatment and care of sick people, 5. Rehabilitation and palliation, 6. Community development, 7. Population and public health, 8. Education and research, 9. Policy development and advocacy. End of study session 2. Thanks for listening.